You're listening to the new media. You're listening to Mitchell Talks. Learn more at MitchellTalks.com and follow me, Scott Mitchell, on Twitter at Mitchell Talks. Welcome to a Mitchell Talks series, the proposed tobacco tax increase and why health advocates are pushing so hard. Our guest is Dr. Bob McCaffrey, physician and professor at the University of Oklahoma College of Medicine and Associate Director of Policy with the Oklahoma Tobacco Research Center.
If we just take hospitals, we're looking, in the current proposal, about 50% of the tax will go to Medicaid. If you look at rural hospitals, they live or die on their Medicare and Medicaid payments. So if right now, if you don't have an increase in their payments, or certainly if you have a decrease, there will be more and more rural hospitals closing. We've already had several close because they simply can't, they're not economically viable. And you could argue that, well, maybe they didn't provide good care. But in fact, for economic development, having good medical care in a small community is absolutely essential. For them to be able to tell a small company looking, and there are companies that like to move to rural communities. Their workforce likes to live there. But if they don't have access to health care, they don't want to live there. And so I think that having a physician, for example, generates, I've seen the numbers, but it's several $1 million for a community. So we're really looking at huge impacts across the state. And since we are a largely rural state, well, I guess most of our population still lives in Oklahoma City and Tulsa, but still we have large rural areas. This is important to have a hospital, to have health care in those areas. But the economic impact of good health just underlies almost every issue that you want to talk about in the state.
Do you think people have become desensitized because we've seen there's been several bad budget years and sometimes we hear the same messages, and I wonder out loud sometimes if this isn't, people are not paying attention to the gravity of the situation. For folks who are new to the state or they're trying to raise their families and get their kids through school, all of these sorts of things, what do you think is the messaging that maybe legislators, maybe the media have missed in all of these discussions?
Well, I think the message that has been missed is largely what we've been talking about, and that is I think that they dismiss the fact that these issues really penetrate almost every aspect of our lives. For example, if you're in the grocery store and somebody buys a pack of cigarettes, people don't realize that at the same time that person is taking $14 out of their pocket.
How so?
Well, because of the cost of the state. As I've already told you, the tax brings in maybe $250 million, but the cost of the state is about $3.6 billion. So every family in Oklahoma pays about $900 every year for the health care and other economic losses due to cigarettes. So even if you're a non-smoker, you are paying for the smokers in the state. People say, well, it's my right to smoke. Well, it's not. Not if you're taking money out of my pocket. So right now I realize that it's legal to do so. That doesn't mean that it's necessarily correct, but people don't understand that this is money coming directly out of their pockets. And in fact, if a smoker quits smoking on the average, they're going to put another $2,000 back in their pocket. And if people have sometimes said that this is a tax on the poor because the lower economic strata of people smoke more. Well, it's not. We have good data on that. First of all, people within below median income tend to be more sensitive to price. So they tend to quit or reduce their consumption more. they also benefit a great deal more in terms of the health benefits of stopping smoking. So actually, this is more of a benefit to the poor. And if you're putting $2,000 back into their pocket, that is a huge economic benefit for the lower, below the median income people. There are just so many. It's hard for me to state a point that perhaps has been missed, because this information has been out there. As you said, people get desensitized to this. But I think the key thing is this is the single greatest thing we can do to help the people of Oklahoma.
You've had a lot of patients over your career, and you've done a lot of research. You've worked in the field of education. Can you talk to us about maybe a case in which somebody was able to get off of tobacco? You've touched on the fact that there are some research about how you can add years to your life, but any case come to mind in terms of changed life because they were able to reach out for help and get some help and stop smoking?
Well, I've seen quite a few of those. In terms of changed lives, what I can tell you is that I can't tell you that somebody picked up their bed and walked because of it. What I can tell you is they come back and they are so grateful for having stopped. And we know that 75% of smokers want to stop. It's an addiction. And sometimes it's looked on by non-smokers as a moral failure. It's not. It's an addiction. It's an addiction forced upon us by the tobacco companies because they do market to children. And we know that the younger you start smoking, the more likely it is you're going to be addicted, and the stronger that addiction. But these people who have been released from this prison of tobacco, if you will, are so grateful that they have a healthier life. They can breathe better. They can do more. They can enjoy their kids or grandkids more. They feel like that they've been given a new lease on life.